Dr. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. Today we're going to be performing liposuction of the chest or treatment of gynecomastia. There's different ways that you can treat this. This gentleman comes in, wants his chest as flat as possible. On exam, I think he mostly has fatty tissue and probably has some breast tissue. So what we're going to do is very aggressively liposuction all of these areas here. Whatever breast tissue remains will not come out with liposuction, and I'll directly remove from this incision right here. So we'll go ahead and we'll make his chest pretty much as flat as we can make it. So the first step is we'll infiltrate. The second step is we'll liposuction. The third step, if there's any remaining breast tissue, that will be directly removed. We'll show you some of the key steps as we go along. So we're back. I'm starting with the infiltration, which is, if you've seen from some of the other earlier videos, is lactated ringers, epinephrine, and lidocaine. And this will go in before we do the liposuction, primarily to help out with blood control or blood loss, and then also the lidocaine helps with pain control after the surgery. So it's going to go into all these areas here. You can kind of see this sort of puffing up. That's normal because of all the fluid that's going in. So we'll put it in all these different sections. And then once we're done there, we'll begin the liposuction. So I'll come back once we started the liposuction. We're back. We're starting with the liposuction. This is a power assisted liposuction. Really helpful on a case like this where the fat in the chest is usually very fibrous, much more than in other areas. Men tend to have a little bit more fibrous fat than women in general. So just kind of going back and forth. You can see here the fat that's coming out, this kind of yellow whitish fat. And so I'm going to go and I'm going to flatten this as much as I possibly can with the liposuction in all these areas that I have marked. And then once I'm done there, I'll come back and I'll reassess if I have any breast tissue that needs to be excised. And if we do, we'll directly excise that. So we're back. So I ended up doing just liposuction only. It turns out that there really wasn't much of any breast tissue here. So when I pinched there, you can kind of get a feel. And really, there's very little, not enough for me to go in there and try to directly remove any. It's flattened very nicely with just liposuction, so probably good news for him. It's always a little bit difficult to tell preoperatively. I always try to predict, and sometimes I'm right, sometimes I'm not, but this will be the ultimate test because breast tissue will not come out with liposuction. So we've contoured all of these areas right here, and just so that you can kind of appreciably see the difference between the right side as compared to the left. So the next step is I'll go over and do exactly what I did on the left side to the right side, and we'll be done. All right, so we're back. We're all done. Both sides have been completed. Just to kind of recap, I did not need to remove any breast tissue directly because I really didn't feel like there was any. So, but very aggressive liposuction, and you can see the difference here on the table. See this pre-op. So we'll have flattened the chest pretty significant amount with a pretty simple procedure. I think after he heals, he'll be very pleased, be able to wear tight-fitting shirts or no shirt with confidence. So this is the procedure. I'm Dr. Mark Jabor, Cosmetic Surgery Laser Center of El Paso. Thank you for watching.